Good morning, everyone. Welcome to our attendees. My name is Madhavi Dandu, and I am the Program Director for the Master of Science in Global Health program. Today, we're going to be focusing mostly on our international applicants. So we're hoping that many of you who are considering are international applicants, and we might be able to answer your questions. But of course, even if you're not an international applicant, we'd be happy to take whatever questions you have for us today. I'm going to go ahead and first go through a couple of slides, and then we'll go ahead and meet our wonderful panel of alums. Rachel, can you move forward for me? Okay, so before I introduce everyone, I just wanted to take 1 second and say that we are really excited this year to have tried to enhance the project process a little bit for our international students. And one of our goals in this session is to help answer your questions, but hopefully also one of the other things that you'll notice is that from the answers to these questions is that there is a huge group of students, not just the ones that are here, who are either international students or who spent a fair amount of time living in another country. And so if there's somebody here on this panel or some very specific questions you have, you can always reach out to us as well. Let me go ahead and ask our panelists to start by introducing themselves here, and we'll just go in the order that's on the screen, and then we'll move forward to the next slide. Lucia, will you go first? Oh, and also when you introduce yourself, I know it says what year and a lot of your background, but maybe you can also share just where you were when you applied to the program.
Hi, everybody. I'm Lucia. As I'm originally from Mexico City. I applied the program after my master's. So after working in a rural community, the master's in science, I've stayed at the Institute for Global Health Sciences at UCSF, and I am currently a third-year PhD student in Global Health Sciences. My research mainly focuses around COVID-19 vaccine access for Latino immigrants in California and then in Latin America as well, with various countries. I also work with the Department of Public Health of California, the California Department of Public Health, with a similar approach, working with Spanish speakers in California to improve uptake of the vaccine. I'm glad to be here.
Lucia, Graham?
Good morning, everyone. My name's Graham Hinchcliffe. I'm from the UK originally, England, the north of England, and I graduated from the master's program in last year in 2021 in the sort of the 13th cohort. I now work as a course assistant for the 14th cohort, so I've stayed on at IGHS. My background is in healthcare quality and regulation, and I worked for about 15 years in the NHS in England doing quality work, and also set up my own quality healthcare consultancy. But I'm here living in San Francisco, and I'm looking forward to talking to you all today about my experiences.
Graham, Joel?
Yeah, hi everyone. My name is Joel Igu. I applied to the program from Nigeria, where I was working as a doctor. Since graduation, I've done a bit of work with the Center for Global Surgical Studies at UCSF. I've also done an MBA at Johns Hopkins, and now I work in consulting. Currently based in Nigeria, but do a lot of work across all of Africa. So I work as a consultant in the public and social sector. I'm excited to meet everyone and answer any questions you have. Thanks.
Thank you, Joel. Obi?
Sure. Similar to Joel, I'm also Nigerian. We're actually in the same class in medical school and coincidentally in the master's program as well, so class of 2015. At the time I applied, I had worked in Nigeria after graduating medical school for maybe about 5 years. And at the time I was an offshore physician, working practicing medicine on offshore oil rigs. Also at the same time, I was running a nonprofit, which I founded called Joint Medical Lifesavers Foundation. I transitioned to the US, did the master's in global health, and then right after that worked with the UCSF Center for Global Surgical Studies. for a couple years. Right after that, I transitioned to a surgery residency in Maine at Maine Medical Center. I'm in my 4th year, and I'm looking forward to becoming a cardiac surgeon.
Thank you, Obi. And Paul?
Hi everyone, my name is Paul. Before applying to the program, I was at UCLA, so I came straight out of undergrad. I'm originally from India, and after the program, I stayed on with IGHS. I worked as a course assistant and did some research with my capstone mentor in the commercial and social determinants of metabolic disease. And now I'm in Singapore. I am getting a medical degree from Duke NUS Medical School. Looking forward to answering any questions you may have.
Thank you all so much for being here. Rachel, next. Oh yeah, good. So we have everybody here. We aren't giving a lot of general information about the program. We hope that you can find a lot of that information online. But just to very briefly summarize, in case you aren't aware, we are a 1 year, but really like 10.5 month long program. Which starts around September and ends at the end of July every year. And our students, we have generally between 30 and 40 students a year that range from, recently out of undergraduate to like Paul to, more than a decade of work before, like Graham, and all the way in between. And in general, our students take all of the same courses over the year, except for one elective, that are focused on everything from methodology that you might imagine learning quantitative, qualitative methods, as well as systems and policy, and then disease-specific courses as well. So before, I don't really want to spend most of the time talking, so I'm going to go ahead and launch in and really ask each of you. So when I ask these questions, everyone is welcome to answer, or if you just want to pass, it's okay. I really am curious, how did you first learn about the master's program? And really, why did our master's program here at UCSF, and why did you want to come to UCSF for the program? Oh, anyone can unmute and answer, or I can call too, either way.
Sure, I can take a crack at it. At the time I was looking, I knew I was interested in becoming a surgeon, but I was also interested in applying the principles of public health to surgery. So I was looking for programs that would be amenable to that. I also knew a little bit more about global health from a few of my colleagues and peers. So first thing I did was a Google search, which was top programs for global health in the world. And UCSF was obviously on that list, high up on that list. I'd looked into some programs in the UK at the time. I'd looked into programs in the US, and the things that appealed to me a lot were, one, it was a 1-year program. Two, the quality of the faculty in the program was the second thing that was there. I did have my GRE, but it was also helpful that the GRE wasn't an obstacle to applying. I think that was also something that was really attractive to me at the time. So probably those are the key things that I looked into. And then when I got to learn more about the program, I actually found out that the things I was interested in pertaining to surgery were actually being done here at UCSF. That pretty much sealed the deal.
Thank you, Obi. Thanks for the reminder that we don't really focus at all on the GREs. You don't have to submit them. You don't have to take them. Just as a note, we do a request if you have not. This is a requirement of the university as a whole. If you did not study at an English-speaking institution, we do require either the TOEFL or the IELTS exam, and we could put that in the chat as well. I know there's some Q&A coming in, but why don't I ask one or two other people to answer that question for us?
I can answer next. I know my internet is not great, so I can turn off my camera if that makes it better.
Yeah, why not? Maybe that's a good idea, Lucia. Yeah.
Yeah, sorry, I'm not home right now. But so as I was saying, when in Mexico, as part of your medical education, you get to work in rural communities for a year or 2 years. So I was doing that in practicing medicine, and I think I really decided that what I wanted to try was more of like, I saw a lot of like very, very like impoverished people seeking care, very sick, and there was really like a lot of obstacles for their care. So I decided that I also wanted to include like more public health type of work in my career. So I was looking for public health programs, but then I ran into like the idea of global health, and I thought that suited my interests better than just general public health. And I was going to actually move to the Bay Area because of my partner's work. So I found the UCSF, and I also applied for a couple of different schools, but I decided to go to UCSF just because of like the focus on that, like the values I think that like were so interesting to me, and also, and I think I really made that great choice because I'm still here. So yeah.
Thank you, Lucia. Does anyone want to add anything else that they were kind of looking for or that drew them specifically here to UCSF? And then I know there are a couple of questions in the chat, so I'll move to that afterwards.
Maybe I can just quickly add in addition to everything that Lucia and Ruby have said so far, I also liked that there was a capstone project where we got to go into the field. Even though it was just a year-long program, we still got to go into the field and actually experience global health as opposed to just, doing research from our desks. So I think, and that really added value as well, looking back so many years later to my experience and to what I know now. And
Thank you, Paul. That's a really good reminder for me to say, though it's not a requirement at all, many of our international students actually, oh, I'm sorry, hold on. Many international students actually choose to do their projects domestically in the United States because it's a great opportunity. And again, it's not a requirement if you have some other place you'd like to go, but many of our students, international students, find that it's a great opportunity to explore the US-based health system or populations and people and projects in the United States as well. So thanks for that reminder. I have several other questions, but I'm going to actually jump to the questions in the Q&A first, so we make sure we answer the questions from our attendees. So one of our attendees, and apologize if I pronounce your name wrong, I think it's Nasia McKinnon, asks, I'm an international student from Ethiopia as well, and I'm very interested in this grad program, but for grad programs in general, a huge barrier is cost. I personally hope to apply for medical school afterwards as well. So I was just curious if any of you are comfortable sharing how you manage the finances. Are there any scholarships and financial aid through UCSF? And I will also answer the financial aid question afterwards, but I would love to hear from any of you about how you manage the costs of the program. Anyone open to sharing?
Sure. So cost is an obvious obstacle, I will say. At the time, I think it cost about $42,000 for the tuition. And then there was the other cost of accommodation, which, San Francisco is probably not the cheapest place in America. So that is something to keep in mind. For me, I think I anticipated the cost, and I was fortunate in a number of ways. One was, at the time I had a job that could give me some, financial wherewithal to offset some of that cost. And planning ahead was also helpful. But I was also fortunate that the program did offer me a scholarship at the time. It was a part scholarship of $10,000. So it's a quarter of the expenditure, and that was spread out across each quarter of the program. So that also did come in handy. I would say recommendations would be look into local scholarships. I can speak to some of the scholarships in African countries. In Nigeria, for example, there are some scholarships that you get after national service if you get the President's Award. That's one thing to look forward to. There are also some other local scholarships that you may have from your country that may be applicable to a master's program like ours at UCSF. The other thing to look at would be opportunities for funding at UCSF. There might be some that you can actually look into, and it may not be something that's directly applicable to your tuition. It might be something that would offset your accommodation. There might be, you might belong to a certain demographic, say disadvantaged females, or scholarships that pertain to a particular demographic that you belong to, be you Latina or African. So it's something that if you do your research, you might be surprised what you find. There might be opportunities like that. There are also Fulbright scholarships that you can look into. I had a classmate from Germany who was also a Fulbright scholar, and that also did help as well. So there are multiple options, but you only know when you do the research.
Thank you, Obi. Does anyone else want to add to that?
Yeah, I think I'll just chip in just to share my own experience. So it is true, as Obi has said, that San Francisco may not be the cheapest city in the world, but I think being at UCSF was great because, there are shuttles in between campuses, and, there's a whole student environment there. So I think, yes, the tuition might be one thing that you need to pay for, but I think just being in a great place surrounded by that community was something that helped me get past the sort of daily expenses of living in San Francisco. And I do have a sister who is a nurse at UCSF, so that also helped, just having family around.
Thank you for that, both of you. I did want to say that, so Obi mentioned scholarships from the program. We have a variable number of scholarships every year that's really dependent on essentially philanthropic donations to the institution. And that really varies from time to time. And we do prioritize our international students, but obviously can't guarantee that level of scholarship for most folks. But most of our students work take out loans to do the program. And that's true for our international students and our domestic students as well. The other options are very well discussed by everyone. For example, thinking about Fulbright, thinking about national scholarships from your country of origin. We've had a lot of students do that. I know Nigeria had some, Mexico has some, India has some, it depends. And some of our European colleagues have had some of those same experiences. And many of those actually do request that you come back to the country that you are getting the scholarship from to do work, or do what Obi did, which was already complete social service or service in your field prior to receiving the scholarship. We also have a really excellent financial aid office, and we can put the name of the email address or the contact information for our financial aid office in the chat as well, so you'll get a chance to see that. And then just also, once you apply, we can also have specific conversations with you. We recognize for our international students that there's an extra challenge compared to our domestic students in terms of the cost, because in order to get your F1 visa, your student visa, often you have to show the full cost of tuition plus the cost of living, or at least a significant portion of it, in order to actually apply for your F1. So there are other members of our alumni panel, et cetera, who we can try to connect you with to think through that process, especially if there's someone from the country that you're applying from. Sorry, Graham, were you going to say something?
I was just going to add, one of the small things, but that students actually really find benefits them a lot is the student food market that we have on campus every Thursday, which is where students can register and pick up a bag of essentials, fresh vegetables and fruit and other foods as well. And a lot of students rely on that every week, but it's a great little bonus. It's run through UCSF, and it sort of keeps, in San Francisco, where it's really expensive to buy food, it's a lifeline for a lot of students.
Thank you so much for that reminder. Yes,
and
absolutely. Lucia?
Madhavi, and just to add that there's also housing within UCSF, which it's not free, but it's cheaper than living in San Francisco. So that's another thing the university can offer.
Yes, absolutely. And while that's been a lottery system, I have to say that eventually pretty much all of our students end up being able to get into housing, and many students choose to live with other students from the program, which we can help coordinate in order to, first of all, just have a community, especially if you don't have one coming to San Francisco, but also because rent is also less expensive when you take a unit that is yeah, has multiple people living together. So, and they're really close to campus, so it's very easy to go back and forth in the day.
And they have lovely grey ceilings.
Yes, works great.
One other thing I would add is it's pretty rare, but it is also an option. There are some assistantship positions. Occasionally you have, an international student or some student who is able to, find a job at the institution, be it within the Department of Global Health or a department that you're interested in working with, and they are able to offset some of your tuition costs for the work in exchange for the work that you do. I know someone who's done that in the past. It isn't the rule or the norm, but it is something that is possible. But you have to do the work and the research to identify that you're interested in the particular field of research or work, and identify a mentor or someone who's working in that space, and then reach out to that person to connect either before you get here or when you get here. My preference is that you do that before you get here.
Thank you, Obi. Yeah, and that is something depending on your financial aid application and your visa status. And sometimes people can qualify for work study options, but that really depends a little bit on what your specific visa status. And we have a really outstanding international students and scholars office. It's called the ISSO, and they're just wonderful, and they've been such great supporters of our program broadly. So that's another link that we can provide for you. I'm going to move to the next question from one of our attendees who asked, for those that are pursuing medicine or in medicine, how did your experiences at UCSF's grad program impact your journey within healthcare? Paul, do you want to start just talking a little bit about your decision to go to medical school, et cetera?
So actually, I knew I wanted to go to medical school before I came to the program. So I specifically wanted to go to medical school, do this program before going to medical school. So I had this lens through which I could see everything that I'm doing in medical school now. And actually, I decided to take a break before going to medical school and staying in global health for a while, just because I enjoyed it so much. But being in medical school, I can really see that if I had not done the program, I don't think I would have a holistic view of healthcare that I do now, to really understand my patients' needs and how to really optimize a healthcare system as well, not just look at only the physician-patient interaction, which is a lot of what we do in medical school. So I do want to continue doing global health and public health work even after I become a physician. So I think it has greatly impacted my journey and completely changed it. If I had not done global health before, then I probably would just have I wouldn't have this view so early on in my medical career. It will be something maybe I see later on as I realize that, the gaps in medical healthcare really do lie in prevention and providing population health.
Thank you, Paul. Do any of our other physicians on the call want to add anything?
I think I'll just chip in. So the way I would describe a master's in global health, especially the one at UCSF, is beyond medicine, it's a license to do whatever it is you want to do and do it very well. It's often how I describe it to people. You might be in politics, you might be in public policy, you might be in medicine, whatever it is you do. It's really a way to broaden your view, because there's always a global health perspective to almost everything, every career that you could think of. And this program really helps you see that and achieve that. But with respect to my interests, at the time I was in Nigeria, I thought I was thinking about something very novel, which is the connection between surgery and global health. I'm putting that together. And I got to UCSF and realized, no, the person who started the program was actually a surgeon. So it wasn't novel, it was already going on, but it was something that was a growing field at the time, which is the field of global surgery. And I would say I probably was very lucky that I came in at the perfect time, because from that time, the research in global surgery and the field of global surgery pretty much just exploded. And now certain subspecialties are actually getting more recognition, like cardiac surgery is getting more recognition, trauma is getting recognition, anesthesiology is getting recognition. What it does for you is it helps you establish a bridge between surgery and global health, which for me is surgery. But you also begin to meet the leaders in the field in surgery while you're still in global health. So that at the point in time when you're interested in transitioning to that career in surgery or whatever field it is you're interested in, be it infectious diseases, you already know the leaders in the field because of your global health experience. So you're already ahead of the game and you already have a foot in the door. And those are also people that you would be talking to, for example, if you're interested in applying to medical school, or if you're interested in applying to residency, or way down the line in your career when you're looking for a job, or you just want to expand your view of the field, or you're looking to reach out to someone to participate in the conference. So I would say it's been extremely helpful. I think it's probably the most helpful experience of my time here in the US.
Thank you. I'm going to move to the next question, but before I do that, I just wanted to add a thought just from my own perspective for the folks that are interested in health professions and those who aren't in global health. One of the things that I've heard most from our alums is just to echo a little bit what Paul and Obi are saying, is that I think the framing of health as a much broader field of thinking about everything from systems and structures that keep people healthy or maybe help make people sick, thinking about different ways to approach health in the medical field or health professions field and outside. We also have, just to be clear, I know we have 4 physicians or at least almost physicians or physicians on the call, but we also have had many nurses, pharmacists, dentists, and other health professionals. But the majority of our students are in a bunch of other fields. And I think recognizing not only all the structures and systems that go into health, but also all the different ways to impact those systems, as Paul was getting to, like with policy or determinants and so on, is one of the bigger areas of impact for the alums that I've spoken to, thinking of being able to approach whatever they end up doing from not only a broader perspective, but with a skill set for broader types of intervention. Our next question, we have Mai Lian, who asks, she says she's an international student from China. I've already submitted my application for the Global Health Program, wondering when the results will come out. I'll answer that. But then I'll say, and she asks, and what do people usually want for the job after graduating from this program? I'm a little unclear about my career and hope to get suggestions from you. Thank you. So just to be clear about the application, thank you for submitting. We're in the process of reviewing all our applications, and we're hoping to get back to most of our international students by the middle of February. Many of our international students also go through an interview process with us, so you'll hear back from us hopefully just within the next month to get that process started. So thank you for applying. We're really looking forward to seeing your application or reviewing your application. In the meantime, I can give you some ideas later about what students do afterwards, but each of you talked about the first year or two after you finished and kind of what work you did. Maybe you could describe that a little bit more and how you chose to do what you did right in the beginning after you graduated from the program. Graham, you want to start by just telling us a little why you chose to be a course assistant and maybe talk about the OPT process a little bit?
Yeah, sure. So I graduated from the program in July, and as part of my F1 visa, there's an additional year called OPT, which is optional practical training, which allows you to sort of stay on in employment or even as a volunteer in a global health related career. As long as you're working, I think it's 20 hours a week, you can apply to stay on. So I'm actually here still on my student visa at the moment, even though I am working. And what I decided to do was, and I think, a lot of the students do decide to do this, is to apply to be one of the course assistants for the program. So having gone through the program and graduated, now I'm sort of in a role where I'm planning the curriculum and assisting the professors within the class and classes with sort of delivery of materials, actually doing some lecturing and running seminars myself, doing some grading, things like that. So I wanted to stay on, not only because, after a year, I found the whole master's course so fascinating, and there's so many different aspects to it. I didn't want to leave, and I wanted to develop my relationships further with faculty, and I'm still learning now. It's almost like I'm doing the masters again. So that's why I wanted to stay on, and also to sort of find out if there are any other further opportunities within UCSF after this year, because this is a one-year position that I'm in as well. But there's so many opportunities, I guess, within UCSF. I'm also doing research at the same time as being a course assistant. So my capstone was looking at the impact of COVID on HIV care delivery and mental health care. And I've had the opportunity to work further with my mentors and other people within UCSF in looking at doing research into these areas and publishing my capstone research as well. That's in the process at the moment. So it's opened up this whole sort of world of opportunity, and I wanted to stay on and develop that more.
Thank you so much, Graham. I'll just summarize a little bit in terms of what people do right afterwards. I think this example is exactly one of them. They stay on at a job at UCSF, so as a course assistant, or with their mentor, or with the Center for Global Surgical Studies that Obi and Joel did. So opportunities to stay on to work. And a lot of times our students, whether international or domestic, do that because they are, just like Graham was saying, that there's more they want to dive into. A year is really short. Sometimes they want to continue the work that they did on their project. Sometimes they're preparing to advance a set of skills. Like, let's say they did qualitative research and they liked it, and so they want to do more of it so they can feel like the skill set is really solidified afterwards. And then many of our students do go on to apply to other advanced degree programs if they don't already have one. So medical school, PhD, etc. afterwards. And then some of our students, go on, or like Joel did an MBA after our program. But a lot of others, I think, afterwards are really thinking broadly about what kind of skills they want to continue to enhance. And so many of our students, I would say within 5 years of graduating, are putting all those skills together before they jump into finding their long-term career plan. In terms of, before I jump into the next question, I'm going to skip that one and go down to another one because this relates to graduating too. One of the other attendees says, are there any graduates from the program who decide to pursue a PhD in STEM fields, such as biomedical sciences and lab-oriented research? So there are. We usually have 1 or 2 students a year who are interested in lab-based or very traditional biomedical science research. And there are a lot of opportunities to do lab-based projects in the program. However, I will just say, and I'll ask Lucia, because she is doing her PhD here, to chime in and see what she feels. But I would just say that being ready for a PhD is a combination of everything you did before the program and the program. So many PhD programs require a fair amount of research before you go on to do a degree program. And also get a chance to do, what they want to see, that you have a set of skills built up to be able to do the PhD in a timely manner. So every candidate who comes into our program may or may not be ready right away after the program to jump into a PhD. But Lucia, do you want to share your experience of applying to the PhD program?
Yeah, I wasn't even going into the master's degree. I wasn't even thinking of pursuing a PhD later on. And I actually, like Graham, stayed as a course assistant for the first year after my graduation. And when I was there, I was like, I really like this. I think I want to continue my education in global health. So I decided to apply for the PhD. But what Madhavi says is very true. So the master's program doesn't have it's not an entry to a PhD in UCSF. So they're not connected. I had to take all the classes and everything, and I had to apply. Just compete with all of the applicants in the same level. Some of the requirements, at least in the PhD, I applied to, and the others I researched. was definitely like almost 5 years of work experience in a related field, research experience. So they do have, I mean, it depends on what PhD you're looking at, and I would recommend just reading the requirements for that. But even though the master's degree is like a very good base for continuing education later on as I did, there's like other things that also come into play when applying for the PhD.
Thank you, Lucia. I'm going to move to the next question just so we can have enough time to answer everyone's. One of the attendees asked, just based on the fact that the prompts, so we switched our application to a prompt-based application with several questions, just based on the fact that the prompts are on the shorter side, I was wondering if there's anything you suggest we emphasize or any general tips regarding what to highlight on the application. And they ask, is there an interview? And yes, for many of our international candidates, we do have interviews. Anyone have any tips on what you think should be highlighted in an application?
Yeah, certainly. I think that one of the key things is authenticity, being yourself, because when you're doing any program, particularly related to global health, for example, medicine, it's important that your passion shows. It's important that you apply yourself to sort of the program, its values. There's a lot of work that you do in the global health program, even after, that's value driven, that, uplifts populations, that is impactful. And so I think thinking through what your long-term ambition is, thinking through what makes you tick and why this will help you grow and help make others grow is something that should come through in your application. So, just that authenticity is important, as well as the routine and regular things you'd put on an application, like things you've achieved and so on. But I think it's an opportunity to let yourself show and to let yourself shine, but being authentic while doing so.
Thank you so much, Joel. I'll just add that, so we are very, very interested in meeting the needs of the students who end up in our program. So most of the time what we're looking for is fit. And when I talk about fit, I'm not talking about any of these other things. I think being super authentic is exactly right. But we also are a very narrow program in the sense that we only have a certain type of classes. We have a certain series of types of mentors that work in a health sciences institution. So if you said to me, I'm really, really, really interested in working with animals who in the field of global health and One Health, we might have some opportunities because we do collaborate in One Health issues, but there might be other institutions that are a better fit for that. So that's what I talk about when I really mean fit. So what we want to hear is who you are authentically, what can you bring to the program, what do you want to get from the program, so we know if we can offer that to you. And then one other really important part is if you have faced any academic challenges, we'd love to hear about any circumstances or just learning you've had that might have led to that. And that's in the specific questions as well. We have a very, very rapid, high intensity program because it's so short. And so we really need people to feel like they're adequately prepared. And sometimes there's a lot of great students who would be maybe might benefit from just like a year extra of other work or other training before they jump into our program, rather than feeling like, oh, that you don't belong in this program. Of course you do, but maybe you'd feel like it would be easier to be successful or would give you more if you had some other detailed experiences prior to starting. So we have had a few students or applicants who've said, you know what, we really think you'd benefit from this, this, and this, and then just apply again another year. And that happens very often. So just being your true self, like Joel was talking about, really thinking about what do you want to get out of the program in such a short time, and really getting a sense of what your strengths and challenges are, because we know we have all of those as we go through. Graham?
I was just going to add, I think one of the things that's important is obviously the global health experience aspect, but actually also understanding that doesn't necessarily mean that you have to have worked in a different country or or anything like that. The global health experience could also mean what you've done locally, perhaps with underserved populations or different groups. It doesn't necessarily mean that you have to have been in a different country doing that work, which I think is important, because at first when I saw that, I was like, well, I don't actually have that global international experience, but I was able to sort of apply it more to what I'd been doing within my own community.
Thank you for that really important reminder that we really take seriously the concept that global means domestic and international. And what we're really talking about is working in resource-constrained environments, and that happens in every setting we're in. And every country has this. Every health system has these constraints, and it's a conversation more about, the theoretical approaches to how you think about health, and what populations you're working with also. And that actually goes really well to this next question from an anonymous attendee who asks, were you ever interested in a public health degree? What was the difference between the two for you, and why did you choose global health over a public health degree?
I think I was, and for me it was more that I didn't know about global health, so I just went straight into applying for public health programs. And then when I got into a public health program and a global health program, I really had to decide. And as I mentioned before, what my interests really were underserved population. So I wanted to really get into, I don't know, indigenous communities in Mexico, work really with Latin America, Central America. And that for me was like a global part of it, what I found in many public health programs. And I mean, there's public, international, global public health programs, but the ones I had applied to that were more general, just like a general MPH, was more focused on US systems and things like that. So it wouldn't apply. What I found when I did the master, I also looked at the curriculum, so at the classes that I was expected to take within each program, and I really liked the ones in the global health program. So for me, that the content of it was more important. And what I'm seeing right now after I got my master's in global health. I'm doing my PhD in global health, and I work in public health, right? I work with the California Department of Public Health. So I've been really able to combine both interests, but my focus is on an underserved community within the United States. So I'm actually doing domestic work, but with a very specific Spanish-speaking immigrant community. So for me, being in global health has allowed me to be both in public health and global health. So I also do work in Guatemala. So that for me was very, very appealing.
Joel, I saw you nodding your head. Do you want to share anything? I didn't notice that earlier. Or Obi, either one.
Yeah, Obi, go for it.
Sure. I think one of the things that comes, it's odd, but I remember one of our first quarters, one of the lectures, Foundations of Global Health by George Rutherford. And an oversimplified way to think about it is to say public health is what happens around me, my locality. International health is what I want to do abroad. And global health is the best of both worlds, right? Being able to do both of them. That's an oversimplified way of thinking about it. But it's also about labels, because the vast majority of the core concepts are the same. So you're going to learn the research skills. You're going to learn qualitative skills, quantitative skills. You may have a few more things health systems. And if you're doing public health, maybe you have more of a focus on a US-based system. But in global health, you're exposed to, the full breadth of what happens locally, what happens abroad. So I will say that the core principles you will find in both public health and global health. But in terms of flexibility and what lets you do a lot more with your degree, global health is probably the direction you want to go. That's an oversimplified way of thinking about it.
Joel, did you have anything else you wanted to add to that?
Not specifically, but when I think about global health or public health, I think about impact. So while programs might have different components and frame a lot of activities differently, I think overall my passion and focus has just been in creating impact. For me, one thing I liked about the Global Health Program that someone has already mentioned before is that it was just a year. And I guess that's because I was excited to make impact faster. But I think public health programs tend to be 2 years traditionally. But there's a lot of overlap in the curriculum and all. So I think, again, it just goes back to thinking through what you want to achieve, why you're doing it. And then these elements of the program then start beginning to make sense to you. You start, things start resonating. You start finding out, you know, what you really want to do and how it programs elements fit into that. Yeah, so this is just the sort of thought process I was having when I was nodding.
Thank you for sharing that. I will just share that I have a public health degree. Global health degrees didn't exist when I did my public health degree, per se, but and I did learn a lot of similar skills thinking about systems and structures. However, I do have to say that even though there is a lot of overlap, and I actually think you can end up doing what you want to do either way, this is where fit also plays a little bit of a role. Part of this depends also on your cohort. So what is it that the people who you are learning with and together, you know, like learning from each other and learning with in the classroom setting, what are their interests? And many of our alums and students have said that having other people with that similar kind of passion to you in terms of thinking globally or thinking about health systems in this broad way is one of the things that they like the most. And our cohorts stay really close, many of them. I think everyone would say they probably are connected with a bunch of people in their cohort still. And part of that is, I think, because everyone's really great, but also part of it is because people have like, no matter how varied their long-term interests in work are, they come in kind of with a similar vision or passion. And so having that community might be another draw to deciding between public health versus global health programs as well. Okay, so we have about 10 minutes remaining. I'm going to choose one of my, if anyone else in the group has, sorry, any of our attendees have any other questions, but I do have maybe one more question to ask it as a whole, and it really has to do with kind of what you're planning on afterwards, a little bit with regards to working in the home country that you originally originated from, and whether or not that's something that you're considering, have thought about, have wanted to do. I know, Joel, you're back in Nigeria now. Is that something that was part of your consideration for deciding to do this program? Joel, do you want to just share a little bit about, you know, going back and what you just?
Yeah, absolutely. So right from when I applied for the program, I had the intention of coming back to Nigeria. Like I said, I'm very impact driven. So I love Africa, I love Nigeria, I love the world, I guess, but I've always planned to make impact. Charity begins at home, as they say. And so, yes, it was always in my plan to do so. And even right now, I work, like I said, with a consulting firm, but pretty much the best consulting firm in the world. It's kind of interesting to shift from medicine into that business space. But a lot of the work I do has positive impact on Africa, and it's just a place that I've always wanted to be throughout my journey. It's been one of the things that took me to UCSF, and yeah, so it sort of, like Madhavi was saying, speaks to my authentic self. Yeah, and I think I am grateful for what I learned at UCSF, for the friends I made, for the experiences I had, for the awesome faculty, you know, even for the techniques and skills, a lot of which I still use even now, where I currently am. Yeah, so in summary, I think everyone might have a different path, but creating impact even at home is something that for a few of us is what matters.
Thank you, Joel. And I know people go back and forth. I know, Lucia, you've done a lot of projects that have crossed back in and out of Mexico and other places that while you're still here. Lucia, do you want to share a little bit about that?
Yeah, so I think similar to Joel, I've always wanted to work for Mexico and Latin America in general, with a specific focus in Central America, but just like at home. And starting with my master's program, my capstone was in that region, and then I've continued to work in projects with that region. And when COVID started, there was a very big need for like Spanish speaker and people that were familiar with people from Mexico and from Central America in San Francisco. So I actually began working local, and I've really changed my perspective in that way. I realized that I could really make an impact in the same population, even if I was working here. So I did not have to like specifically like go to Mexico, but I could really change people's Mexican people's lives here. So that has really like given me a new interest in like immigrant community, Latin American communities in the US. And I do most of my work with that population, but I also do work in Guatemala. So I've really realized that a good thing about UCSF is that you could still create impact from where you are in the countries you're interested in. So that's something that I've really liked too. And I don't feel like, I feel that I'm doing what I'm supposed to be doing with a population that I've always wanted to work, which has been very good, like great for me.
Thank you so much, Lucia. You know, I'm sure we're really getting close to the end of time. I wanted to just summarize a couple of things for everybody. One of the things that I really hope came through was that this program is one that really accommodates people with a lot of different interests from a lot of different places who have really long-term, very different goals from each other. So that's really important, I think, to recognize that if you see things in this program that feel like are exciting to you, it's likely that there's somebody else who has a background similar to yours that might have done it before. But even if not, lots of people come into this program, you know, from different places, different countries, different interests, et cetera, and really succeed in the program, but also in after they leave. The other a thing I want to highlight is that one of the things that I think already talked about is how, or just briefly touched on, is how important the cohort is to the learning. We have really wonderful faculty. I know I'm saying it, but we have great faculty. We have a really great environment, lots of amazing mentors. But I would say that the students who come into the program and how much they contribute to each other's learning and to my learning as one of the faculty, and really like the community that gets built, is really one of the things that I think is special about our program. And I've heard that from many of our alums, and I feel the same way. Each person on this call, I was incredibly excited to see their faces. Some I see more often, some less often. It's a connection that's very human, and we're all learning together. I mean, the one thing about global health is it's a field that is constantly growing and changing, and we absolutely have no belief that we know everything in the program or that we have all the answers. Certainly, if we had all the answers, things would be very different in the world now. So while we can teach very specific elements of skills and knowledge, really what we are talking about is how do we collaborate? How do we communicate? How do we learn? How do we change? How do we adapt? And those things are all really important for us to think about as a group. And when you do that with people who are super interesting and passionate and just cool people to be around, that I think makes all the difference. And that's very hard for us to capture in an application or in any presentations, but I hope that all the alums on this can say that it will agree that, you know, it's the people that are in the room that make almost as much of a difference as anything that we've learned or taught along the way. And then one final part of this is that we don't want the application process to be scary, daunting. If you have questions we weren't able to answer, you can just email us at the education email address anytime. If you have considerations where you're wondering if it's the right fit for you, we're happy to talk to you before that. We're happy to connect you with alums who might be able to speak with you. So hopefully as part of the whole process, you find that really what you're doing is filtering whether or not this program is the right fit for you. So I know we have just a minute or two left. There, I know was another question for from Aaron, and I know Rachel answered that in the chat. I mean, in the Q&A. So we are very happy to again continue answering questions once we get offline through our email address. I just want to take a moment to really, really thank all of our alums. It takes a lot. Everyone's in different places, different countries, different time zones. So I'm really, really grateful for all of you for not only this session, but just staying so connected and really keeping us abreast of all of the different exciting things that you're doing. So thank you all so much for being here. And I'm not kidding that I'm very, very happy to see your faces this morning. And thank you for all of our attendees as well.